Happening now in North York, Mayor Olivia Chow and Toronto's paramedic chief are making an announcement about supporting safe communities. Let's listen in.
Husband who crashed his bike and shattered his knee, or my late mom who broke her hip because she fell, or my late dad that had pneumonia and couldn't breathe. All of those cases, when we called, the paramedics were there, and that sigh of relief to know that your loved one is going to be cared for. And that is so, so important. Paramedics offer a caring hand. They figure out what needs to be done to save a life. They urgently get the people the help and the care they need. And Torontonians deserves a paramedic service that is quick to respond in an emergency, because people cannot wait. A service that will be there for them when they need it. And paramedics who can provide a high quality of care and service, who aren't burned out, and can deliver the emergency support people need. Now, the city is growing tremendously. In the last year, the city grew by 270,000 people. We are growing. And also, we have an aging population. So we have predicted that the paramedics' demand will grow by 11% in the next few years. We also have a drug crisis that claims 500 people, 500 lives every year. And more paramedics are stuck in the emergency room waiting to offload patients. So we are taking action to make sure communities are safe and get access to the emergency they need. I'm proud to announce a new plan to hire 362 frontline paramedics, superintendents, and support staff over the next 3 years. This is a multi-year hiring plan. That includes, just this year alone, 112 more paramedics. This will quickly address our safety and emergency services need. Coupled with that, we have a comprehensive plan to increase the number of all frontline first responder, which is for this year, 52 firefighters, over 360 more police officers, and now 112 more paramedics. On top of that, we have increased the 211, the crisis community services, which deals with people that have mental health issues. We are also, to keep people safe, investing in young people and families to make sure in the summer there are role models and mentors for young people. And we announced a summer safety plan, which will help increase activities for 3,000 young people to participate in violence prevention programs and summer recreation activities. These investments in emergency services, law enforcement, mental health crisis workers, and local community programs together, they make the neighborhood safer. Now I would pass it to Deputy Chief Melanie Jordansson to say a few words.
Good morning. Thank you, everyone. On behalf of Chief Chawla and myself, I'd like to thank you, Mayor Chow, and thank everyone for being here. It is an honor and a privilege to lead an incredible team of extraordinary individuals that come together to make the city safer. This staffing plan is a data-driven, informed approach to provide pre-hospital care to Torontonians and will support improved ambulance availability by up to 20%. By the end of 2028, we will hire an additional 331 paramedics. This is about ensuring our paramedic system remains strong, resilient, and able to respond when you need an ambulance. We have seen a steady increase in 911 medical calls and pressures on the healthcare system. Emergency call demand continues to grow 2 to 5% annually and is expected to increase by 11% by 2028. With the city's growing and aging population, this improvement is expected to improve ambulance availability for Torontonians, support response time improvements, and reduce workload demand pressures on our frontline paramedics. I would like to thank our incredible staff for their hard work and dedication in serving our communities, and the mayor, as well as our supportive partners of the city, the province, and Local 416.
Thank you. Would you like to say a few words? No, you okay? All right. But thank you for being here. Thank you all. This is where you work. Thank you. Some of you may have some questions or not. Oh, don't tell me you're shy.
I've never been accused of that, Mayor. Thank you. Alan Carter from City News. This paramedic plan is contingent on the province continuing to fund at a 50% rate. Otherwise, it just does not happen.
That's right.
Why are you confident they will continue to do that? What have you heard from the province?
The provincial government in the last 2 years have always met the demand. They've never backed out of providing half the funding. And I'm quite confident that they will understand the needs of increasing more paramedics on the street, save lives, and get people the help they need very quickly. So 112 paramedics this year, and overall over 300 plus. So it's something, it's worthy of celebration, and I'm quite confident they will be fine with it.
Is your celebration not a little premature, Mayor? You don't actually have the money.
Oh, we don't actually have the money. We will. I have not heard that there is any problem to receive the funding. It is true on the policing and the firefighter side is 100% city dollars. Paramedics, because it's health related, has always been 50-50 in terms of the percentage. But let's say we have been in conversation. This is not a surprise that a city that grows by 270,000 people a year will need more first responder. And the Premier has always said, we want safety first. So it's not an area that I don't believe the province will be shy in supporting us.
I have a couple of questions for the Deputy Chief, if that's all right. I was just wondering if you know how many net new paramedics this will get you this year, and how many gaps that still leaves you guys with, because we know you're understaffed.
Right. So this year we did this stopgap measure through our 2025 budget process of 86, and then we're adding on the 102 paramedics. So is that number correct? 112 for 2025.
So 112 net new paramedics
Yes.
for this year. Okay.
Yeah.
And just to follow up, both for you and if I could get a comment from the union as well, just in terms of we've seen a lot of violence in the city. We know you're understaffed. We know we've seen reports, whether it's from the ombudsman or in past years, about PTSD and the stress level. What has it been like for your paramedics responding to these situations, witnessing these types of kind of first aftermath of these shootings and the like?
Yeah, we recognize it's been a difficult year, lots of difficult calls. We have a number of measures to support our staff internally, but we recognize it has a toll on them, and this staffing plan is hoping to add the more staff to help support them, to spread the workload out, and give them opportunities to access the programs that we have to support them.
So the other thing to remember is these paramedics are the best in Canada, and attracting the next generation of paramedics to Toronto and supporting them through conversations with divisional management in the city helps us to make sure that our members are taken care of. They are under a tremendous amount of pressure right now, and that certainly is something that we're trying to find a solution to, and continue to be open to further solutions.
Well, we've been listening to the mayor alongside Toronto's paramedic chief making an announcement about supporting safe communities. Let's continue to listen in.
Paramedics, also people that answer the 911 call. It's an extremely stressful job. It's sometimes quite traumatic. You can imagine all the difficult situation where they're at. So mental health support is a big thing. And we were told that it was a tough job and people are close to feeling burned out, which is why in the 2025 budget, we put in some money to just start the hiring. And then we immediately said, okay, we need to work on a multi-year hiring plan, which is what you're seeing today. Our commitment is to hire over 360 plus paramedics over 3 years. But this year alone, an increase of 112 paramedics to immediately is 30 every 2 or 3 months that we can hire. So by the end, we would have over 100 paramedics. It is life-saving in really important situation. Every minute, every moment counts. And as you have seen, the emergency departments in the hospital are jam-packed. And a lot of the paramedics end up having to wait there to offload their patients, and they can't leave until they offload. So it's a difficult situation. We'll continue to work with the Ministry of Health and the hospitals to see if we could offload faster. But all of that combined, it said to me and to the city and council that we have to invest.
Once again, listening to the mayor talking about an announcement about supporting safe communities in North York.